Group Cohesion, Increasing Performance in the Workplace by Ashley Hansen. Introduction. Prior studies of groups that work on tasks have found that nothing succeeds like success when it comes to cohesion, suggesting that cohesiveness between colleagues is built after successful completion of the group's goal. However, this study seeks to analyze and study the group cohesiveness between colleagues within a newly established innovative children's program and the possible effects that group cohesion has on individual performance within the group. The site for which this research will be conducted is appropriate, as this researcher will have access to participant observation 10 hours a day, 4 days a week, without unethical engagement. The study of group cohesion among colleagues and its effect on performance is critical for understanding and providing the best quality care to the program's consumers. Furthermore, the program is currently funded by an innovations grant. The permanency and success of the program depends on the performance of its employees. This research will further contribute to the importance of understanding group cohesion and the role it plays in providing consumers of mental health with a continuum of care. As mental health services are transforming to include peer providers with therapeutic models, it has been observed at times that clinicians may be finding it difficult to integrate and utilize peer supports within their evidence-based practices, also known as EBPs. This research seeks to identify possible positive tools for creating group cohesion to increase performance within the workplace. Literature review. A study conducted by Kaba, Wishart, Fraser, Codier, and McLaughlin asks, are we at risk of groupthink in our approach to teamwork interventions in healthcare? The study aimed to discover if there was a positive or negative effect on the outcomes of healthcare provided to consumers when there was a groupthink approach. The authors highlight that adverse clinical events and poor quality health care is unacceptably high, and that data exists that suggests that poor coordination of care or teamwork contributes to adverse outcomes. In the discussion, the authors introduced the concepts of teamwork and interprofessional education. Research of outcomes and data are introduced in the discussion and highlight that one should not assume that increased collaboration guarantees better decisions, performance, and healthcare outcomes. The methods of utilizing existing data and research was the basis of this study. The researchers discovered that prior studies had found that brainstorming results in fewer ideas rather than more and hinders rather than helps productivity. Such explanations of this phenomenon include social loafing and cognitive overload. Other poor decision-making among healthcare providers include groupthink, caused by team orientation and mutual trust, which results in conformity bias and leads to poorer decisions. In conclusion, the author states, in reality, teamwork and IPE are not inherently good, bad, or neutral. Instead, as with any intervention, their effect is modified by the persons involved. Research conducted by Padskoff, McKenzie, and Ahern sought to answer their hypothesis that the group's acceptance of the goals set for it by the organization influences the nature of the relationship between group cohesiveness and productivity. More specifically, that the higher the acceptance of the task given, the higher the productivity. The methods employed in the study was the data collection of 218 members of 40 work crews or groups in a paper mill located in the northeastern United States. Researchers utilized a 3-item version of the scale based on the Stogdill's original work examining the relationship between group drive, cohesiveness, and productivity, focusing on the work group rather than the individual. The researchers compared mean, standard deviations, reliabilities, and intercorrelations of the data. Moderate regression was used to test the hypothesized relationship among cohesiveness, goal acceptance, and work crew performance. The data provided partial support for their hypothesis. However, the study showed that the higher the acceptance of the group goal, the greater the productivity. that in situations where goal acceptance is high but group cohesiveness is low, the managerial challenge is to enhance cohesiveness by reducing differences among group members. This study was very interesting as it sought to collect data of the impact of surface level, meaning demographic, and deep level, attitudinal diversity on group social integration. The authors hypothesized that the length of time group members worked together weakened the effects of surface level diversity and strengthened the effects of deep level diversity as group members had the opportunity to engage in meaningful interactions. This study shed great light and explanation with regards to this writer's research, as within the workforce environment of current observation there is much diversity. However, the group dynamics are divided as some group members have worked together for years, thus increasing their cohesiveness while isolating new group members. Furthermore, the research conducted by Harrison, Price, and Bell highlight that surface level diversity is defined as differences among group members in overt biological characteristics that are typically reflected in physical features, whereas deep level differences among members, attitudes, beliefs, and values are communicated through verbal and nonverbal behavior patterns and is learned through extended individualized interaction. Methods included selection of diversity variables and data collected from samples consisting of 443 employees from a medium-sized private hospital in a large southwestern city. Data collection and measures were administered as questionnaires over the course of 3 weeks and were completed during departmental meetings. The results showed a potential weakness might be inflation of relationships by percept bias, as deep-level diversity and cohesiveness were self-reports. Results were consistent with both components of the moderating hypothesis. Declining effects for surface-level differences were indicated by a significant improvement in prediction interaction with time. In conclusion, the findings of this study suggest that data is significant because they focus on the issues of which level of differences are the most important in ongoing groups of productivity. Sociometry is a quantitative method for measuring social relationships. In this study, the researchers examined sociometry as the measure of mutual preference regarding working together among team members. The hypothesis focused on the effects of density on team cohesiveness, satisfaction, and effectiveness. Surveys such as the Team Diagnostic Survey were used to measure 29 squads containing 129 cadets at a military college. The results showed that teams with a high sociometric or density reported higher feelings of satisfaction within their intra-team relations and more productivity on group and team-related tasks. In conclusion, findings further suggested that sociometric choice and cohesion may not necessarily be the same. So, method. Researcher conducted participant observation of the employees of the Resilient Brave Youth Program. Observation was conducted Monday through Thursday for 10 hours a day for the duration of 2 weeks. Researcher made notes of the group's interactions, cohesiveness, and level of productivity as it concerned consumer outcomes. A 5-point Likert scale was utilized to allow willing participants to express individual and anonymously how much they agreed or disagreed with particular statements about group cohesion and productivity. Limitations. This researcher found it difficult to reach a conclusion about the effectiveness of group cohesion as it pertained to the consumers of the RBY program, as all consumers are new to the program. Researcher was limited to only observing employees and obtaining their individual responses as it pertained to the survey questions. So here is a diagram, a bar graph for the results of 4 of the questions asked on the group cohesion survey. So as we can see, 12 out of 17 participants identified that they highly agreed that how important is group cohesiveness to you? And on the next question, do you think that group cohesion can affect consumer outcomes? And we had a more spread, diverse response to that question. but moreover, more employees identified that they agreed. Is it easier to have group cohesion with coworkers you have known for a longer period? So a lot of the participants identified that they agreed with this statement. How likely are you to build group cohesion with new employees? And I was actually very impressed with this one because all of the employees selected agree and highly agree. And so we'll see later on in the slides that this statement to the survey question was actually verified through their actions, through my observation. So it was discovered through the use of the survey that most employees agreed that group cohesion was important. The chart further shows that all employees highly agreed of the importance of building cohesion with new employees, as all 17 employees self-report that they are very likely to build cohesive relationships with new employees. The participant observation validated the survey findings, as employees were seen going out of their way to introduce and welcome a new coworker on her first day of employment. Researcher witnessed and made notes of employee cohesiveness throughout the 2 weeks. Researcher highlights the presence of groupthink during staff meetings. In these meetings, it was observed that structural differences could be seen and employees didn't speak out about having differences of opinion. It was later realized and confirmed as employees expressed their negative feelings towards meeting discussions without the supervisor and lead clinicians being present. It is this researcher's finding that groupthink is present and may cause support staff to feel decisional stress and make less logical decisions when engaging consumers. Over the course of observation, it was also discovered that employees had stronger relationships when discussing personal issues and experiences. So when coworkers, whether you were support staff or a lead clinician or even the supervisor, everybody seemed more at ease when they were discussing their own personal lives. So, however, when discussions with regards to consumer arise, there seems to be a disconnect of cohesiveness. It was observed that those employees to which have a lived experience, peer support, and parent partner, which the peer supports and the parent partners have a lived experience of commercial sexual exploitation. So it appeared that they would become maybe more boisterous when a clinician or behavioral health staff were approaching situations more from an educational or book standpoint. So that's what I had observed. But furthermore, they had a much stronger reaction and feedback for other employees with regard to consumers' current treatment. It is possible that cohesiveness doesn't actually stem from bonds or relationships between coworkers, but through one's ability to speak their personal opinions and experiences, to which these concerns were then validated by clinicians and behavioral health specialists. It was in the group's ability to hear and validate each other that an increased group cohesion was seen. It was also witnessed that although at times there were disagreements, arguments, and even at times inclusion into one's personal life, every time coworkers came together to provide services to the youth and families of the RBY program, the teams worked in unison and never wavered in providing support, encouragement, and TFCBT to the youth. It was recognized that although there may be disagreement and separation within the office at times, which presents as the groups having little cohesion, this theory is eliminated when the group works cohesively when providing services. So what I'm saying here is that although there was some heated conversations within the office, when it came time to provide such services to the families, the teams became very cohesive in supporting each other during these meetings. Discussion. The research conducted on the cohesiveness of the RBY program employees and the outcomes of consumers was found to be limited in obtaining consumer outcomes. However, it was discovered that within the program, the supervisor utilizes a normative model of decision-making. This theory of decision-making was developed by Victor Vroom and his associates. Being that this is a new program, all functions and aspects of the normative model were witnessed, which proved to enhance cohesiveness as employees were able to share personal perspectives, but ultimately the supervisor made the final decision on implementation of services to consumers, to which employee cohesiveness was at its highest when providing services to youth and families. All employees were in agreement of the importance of group cohesion predicting positive outcomes for consumers, even though I wasn't able to obtain actual data that was collected on the outcomes. It is in conclusion that this researcher is confident in saying that group cohesion is important for increasing consumer outcomes. It is also important to highlight the many factors that increase group cohesion, such as the leadership, individual consultation, so like supervision with the supervisor, group consultation, which was conducted during the staff meetings, facilitation of group problems and concerns, delegation, meeting consensus of group concerns, validation of individual perspectives, and support of coworkers. It was also prevalent for individuals to have a clear understanding of their individual role on the team and the expected plan for engagement. Future research should consist of a longitudinal study of innovative programs such as the RBY program to obtain data collection of the self-reported cohesiveness of the teams providing services of EBPs and the outcomes of consumers. It is in this research such positive tools and trainings may be created that enhance consumer outcomes of mental health services that have a therapeutic and peer support component. And here's my page of references, and I thank you for watching this presentation on group cohesion